Hi everyone, I am Dr. Shahan and today in this video I will teach you important PYQ that are asked in FMGE 2023. So these are the PYQs that are asked in surgery. First PYQ you can see pew de orange, dimpling, puckering, cancer en cures. So these are match the column. So let us do the match the following. Pew de orange, lymphatic permeation by tumor cell. Dimpling, involvement of ligament of Cooper. Puckering, involvement of ligament of Cooper. Same. Cancer en cures, involvement of breast skin and chest wall. So once again, pew de orange, lymphatic permeation by tumor cell. Dimpling puckering, involvement of ligament of Cooper. Cancer in cures, involvement of breast skin and chest wall. Next question. Most probable malignancy that develops in case of long-standing goiter is follicular carcinoma. Next question. 30 years old female with diffuse thyroid swelling. TSH is elevated. HPE shows Hartley cells. So, which disease? Hashimoto's thyroiditis. Hartley cell can be seen in Hashimoto's thyroiditis. Next question. 45 years old male hepatomegaly USG water lily sign can be found in hydatid cyst disease. Hydatid cyst, water lily sign. So if the liver is like this, you can get like this. That is water lily sign, hydatid cyst. Next question. MELD score does not include. MELD score is model for end-stage liver disease. End-stage liver disease. It contains what? MELD score contains CBI, the mnemonic CBI. C means creatinine. C means creatinine. B means bilirubin. B means bilirubin. I means INR. So these three. CBI. Which is not there? Blood urea is not there. Next question. 30 years old female gallbladder polyp 0.5 centimeter on USG. Patient is asymptomatic. Next management. First of all, for gallbladder polyp, GB polyp, always remember this thing. When it is 1 centimeter or more, then we go for any surgery. And when the patient age is 60 years and more, then we go for surgery. And when it is symptomatic and all this. But here the patient is asymptomatic. Here the polyp is 0.5 centimeter. It is not 1 centimeter or more. 0.5, very small polyp. And what is the age? The age of the patient is also less, 30. It is a young patient, not a old patient. So we'll not go for lap cholecystectomy, open cholecystectomy, CCT abdomen. No, we'll not go for all this. We'll just reassure the patient and follow up. So this is the answer. Reassure the patient and follow up. Next question. Component of Q-SOFA. Q-SOFA is very important. Q-SOFA contains three important things. One is SBP, systolic blood pressure, respiratory rate, and the neural status examination. So mental status examination, MS. So we can remember Q-SOFA as QRS-MS. Formula is QRS-MS. Q means Q-SOFA, R means respiratory rate. How much is the respiratory rate? Greater than 22. Next is S. S means what? Systolic blood pressure. SBP is greater than 90 or 100, or you can say more than 90, more than 100. MS means mental status examination. So these three, neural status, that is the mental status examination, respiratory rate, systolic blood pressure, all these are components. Heart rate is not a component. So this is the answer. Heart rate is not a component. So this is the answer. Next question. Which is false about the Pseudopancreatic cyst. What is pseudopancreatic cyst? Anyone knows? Yes. Pseudopancreatic cyst, it is basically formed due to what? Due to alcohol intake. Due to alcohol intake, cyst is formed, and that is known as pseudopancreatic cyst. Contains enzyme. Most common site, where does this pseudopancreatic cyst can be found? Most common site is Lesher sac. Correct. Most common cause is gallstone. Wrong. Most common cause of pseudopancreatic cyst is alcohol. Because of alcohol, pseudopancreatic cyst is developed. Most common symptom is abdominal pain. Yes, epigastric pain can be found. Most cases are managed conservatively. Yes, conservatively. So, most common cause is alcohol, not gallstone. Alcohol. Most common cause of pseudopancreatic cyst is alcohol, not gallstone. Next question. False about leiomyoma of esophagus. False about leiomyoma of esophagus. Most common benign esophageal tumor. Yes, most common benign esophageal tumor is leiomyoma. Most common location. What is the location? Lower third of esophagus. Correct. Endoscopy and biopsy investigation of choice. This is wrong. We cannot do biopsy. Why we cannot do biopsy? Because leiomyoma is a vascular tumor. It is a vascular tumor. Enucleation is the treatment of choice. Yes, correct. So all these are correct. Always remember, biopsy cannot be done. So this is the answer. Next question. False about Borhab syndrome. Most common site of rupture is left posterolateral side of distal esophagus. Yes. Suppose this is the esophagus and this is the stomach. This is the left posterolateral. This is left posterolateral. From here, the content, the vomitus will come out in the mediastinum. Always remember. So, left posterolateral side of distal esophagus. Correct. Mecklers triad is found in Borhab syndrome. Mecklers triad. What the Mecklers triad means? Thoracic pain, there will be chest pain, vomiting, and cervical subcutaneous emphysema. Emphysema will be found. So, three important things. One is thoracic pain, vomiting, and emphysema. Water soluble contrast. So, this is also correct. Mecklers triad. This is also correct. Left posterolateral side of distal esophagus, and this is also correct. Mecklers triad. Next option. Water soluble contrast esophagogram preferred over barium swallow. Water soluble contrast esophagogram is preferred. Yes. Why? Why you do not use barium swallow? We can use barium swallow, but this barium swallow will come out through this hole. So it will be problematic and it will be inside the mediastinum. So this barium swallow will be problematic. So we cannot use barium swallow. So what we use? We use water soluble contrast esophagogram. Water soluble contrast. Why you use water soluble contrast? Because it will be easily absorbable. Water soluble contrast will be easily absorbable. So we use water soluble contrast preferred over barium swallow. Correct. Next question. Golden period for primary closure of the perforation is first 6 hours. Wrong. First 24 hours. So within 24 hours we have to repair this perforation. That is the golden period. So once again, what is false about Borhab syndrome? What is false about Borhab syndrome? Most common site of rupture. Where is the most common site? Left side and posterolateral. Next question. Next option, Mecklers triad. Always remember three important things: thoracic pain, vomiting, and emphysema. Next is water soluble contrast esophagogram, that is preferred over barium swallow. Yes, correct. I told you barium swallow we cannot use because it will be accumulated in thoracic in the mediastinum. Water soluble contrast is used. Golden period for this closure is 24 hours, not 6 hours. So this is false. Golden period is 24 hours, not 6 hours. Next question. False about GAVE. G-A-V. GAVE, what is GAVE? Gastric antral vascular ectasia. Gastric antral vascular ectasia. What is this gastric antral vascular ectasia? What is GAVE? GAVE is also known as watermelon stomach. Watermelon stomach. What do you mean by watermelon stomach? Let me show you a picture. Suppose this is the picture, biopsy picture, endoscopy picture, you will see just like dilated. These are dilated vessels. Dilated vessel just like a watermelon. You are seeing from above. So it will look like a watermelon. So watermelon stomach. That is known as GAVE, gastric antral vascular ectasia. Where it occurs? Antral. That is why it is known as antral vascular ectasia. So dilated mucosal blood vessel in the lamina, correct. Bleeding is most common present is, yes, all these vessels will bleeding. Diagnosis is based on typical endoscopy and biopsy appearance. Can we do biopsy? Yes, we can do biopsy also here. So none of the above is the answer. None of the above is the answer. Next question. All are correct about GIST. What is GIST? Gastrointestinal stomal tumor. Gastrointestinal stomal tumor. Always remember, GIST is CD117 positive. Yes, correct. GIST is CD117 positive. Next, a triad is found in the GIST known as Carney triad. What you can found in Carney triad? Extraadrenal paraganglioma, pulmonary chondroma, multiple GIST. So multifocal GIST, pulmonary chondroma, and extraadrenal paraganglioma. These three are Carney triad. So Carney triad can be found in GIST. That is also correct. Next, investigation of choice is endoscopy and biopsy. Wrong. In GIST tumor, always remember gastroesophageal stromal tumor, that the investigation of choice is CECT. Look at this picture. This is the stomach and here it is occurring. It is GIST. Gastrointestinal stomal tumor. It is occurring outside the lumen. For any kind of tumor which is occurring outside this lumen, that is investigation of choice for that is CCT, contrast enhanced CT. So for the GIST tumor we use CCT, not biopsy. Next is regorafenib is third line after the imatinib and sunitinib. Yes, imatinib is first line, sunitinib is second line, regorafenib is third line. This is also correct. So imatinib, sunitinib, regorafenib. So once again I am telling GIST. GIST is CD117 positive, correct. Carney triad, extraadrenal paraganglioma, pulmonary chondroma, multifocal GIST, correct. Investigation choice of GIST is CCT, not biopsy, because it is a extraluminal. Next is these medicines are correct. Imatinib first line, sunitinib second line, and regorafenib is third line. Next question is this one. True about hypertrophic pylori stenosis. Everyone knows about hypertrophic pylori stenosis. So this is the stomach. Here is the pylorus and stenosis occurs. Hypertrophic pyloric stenosis. So what happens? There is a non-bilous vomiting. Remember, non-bilous vomiting is there. And what it comes out? H plus, Cl minus, HCl. That is comes out H plus, Cl minus, and K plus potassium. So hypochloremic, hypokalemic, and because the acid is coming out, what will happen? Metabolic alkalosis. Next question. While doing emergency laparotomy for intestinal obstruction, which organ would you first visualize to say whether it is small bowel or large bowel? So how can you understand it is small bowel or large bowel obstruction? What organ do you observe first? So first understand this concept. Suppose this is the loop. When there is an obstruction, so the bowel loop above the obstruction will be bulging, and the low and below the obstruction will be decreased in diameter, will be small in diameter like this. So for example, suppose this is the small intestine, okay? Suppose this is the small intestine and here is the cecum, then the large intestine started, and this the large intestine, and it coming out as a rectum. So suppose this is the small intestine, then cecum, then the large intestine. So whenever you open up, we first look at cecum. Look at this question. Question number 15. A patient with SBO means small bowel obstruction. X-ray shows kidney bean volvulus. You know kidney bean volvulus? No. First Generally, people do know that is coffee bean volvulus, like this, coffee bean sepet. When there is coffee bean sepet, we can understand that is sigmoid volvulus. But here it is kidney bean sepet. So it is cecal volvulus. The answer is cecal volvulus. That is the answer. Next question is this one. 26 years old male, 4-day history of right-sided lower abdominal pain, clinically tender lump in the right iliac fossa. Clinically tender lump in the right iliac fossa, we can understand. So this is appendicitis. So what is that management? The treatment is according to the Oshner-Seren regimen. Oshner-Seren regimen will be the answer. Next question. Most common complication of splenectomy. When the spleen is cut, splenectomy means spleen is cut off. Then what happens? Atelectasis. That is the most common complication. Atelectasis basically is the most common complication of splenectomy. Next is this question. Adder head appearance can be seen in. Suppose this is the ureter, this is another ureter, and there is dilatation. It looks like adder head. So ureterocele, adder head. Next question. After varicocele surgery, venous drainage of testis occurs by. So what is varicocele? First, let us understand varicocele. Suppose this is the testis, this is another testis. Drainage is via pampiniform plexus. Pampiniform plexus is the plexus through which it is drained. So suppose these veins have become tortuous, and that is known as varicocele. Now when this varicocele, the surgery is done, then there should be another vein which should be draining it. That vein they are asking. So it is cremasteric vein. So the question is, after varicocele surgery, venous drainage of testis is by cremasteric vein. Next question. All are true about peripheral artery obstruction except. So basically they are asking except, okay. All are true about peripheral artery obstruction except. Rest pain can be seen at night. Yes, when there is peripheral artery obstruction, rest pain can be seen at night. Pain of intermediate claudication can be seen taking the first step. Whenever we are starting the first step, that we are getting the intermediate claudication. Yes, this is also correct. Rest pain seen at night, that is correct. Atheroma is the main cause of this arterial obstruction, correct. Clinical picture does not reflect the site of peripheral arterial obstruction, wrong. Does not, it does reflect. So this is the wrong answer. Next question. All are correct about burn management except. So all these are burn management except. Most common cause of early death of burn is hypovolemia. Yes, hypovolemia is the most common cause. This is correct, okay. First option, most common cause is early hypovolemia, correct. Best clinical indicator of tissue perfusion is urine output. Yes, tissue perfusion, how much it is there, we can understand by urine output, correct. Maintenance fluid of choice in burns in children is RL. This is wrong, not RL. Maintenance fluid is not RL. Generally, we use RL. RL is the fluid of choice in case of burn, but maintenance fluid, it is not RL. It's DNS. Maintenance fluid is DNS. Silver sulfadiazine is effective against Pseudomonas. Yes, correct. Silver sulfadiazine. So, what are the correct options? Most common death in case of the burn is hypovolemia. Tissue perfusion we measure with the help of urine output. Maintenance fluid of choice is DNS, and silver sulfadiazine is effective against Pseudomonas. Correct. Next question. Which is correct about FAST? FAST is focused assessment sonography for trauma. Correct. Done in 2 minutes, 2 to 4 minutes. Correct. First investigation done in case of blunt abdominal trauma. Yes, correct. So all of the above is correct. Next question. All are parts of aseptic wound score except. So aseptic wound score contains serous discharge, purulent discharge, erythema, but not induration. Induration is not a part of asepsis wound score. Induration is not a part. Serous discharge, purulent discharge, and erythema is a part. Next question. 28 years old after RTA fracture of femur comes after 12 hours with difficulty breathing. So you can easily understand it is a long bone fracture, comes with difficulty breathing. So it is fat embolism. Next question. Patient hit on leg comes to ear, has pain on passive stretching. Distal pulse is palpable. So pain on passive stretching, what will be the answer? Compartment syndrome. Compartment syndrome, pain on passive stretching is present. Next question. Not included in latest ATLS guidelines. So latest ATLS guidelines, let us learn. Use of video laryngoscope for intubation, correct. Wideboard needle insertion, 5th intercostal, mid-axillary line, adult, for tension pneumothorax, correct. So always remember, for tension pneumothorax, in case of adult, 5th intercostal, and in case of children, it is 2nd intercostal in pediatric patient, remember. And where in case of pediatric patient, intraclavicular, mid-clavicular line, pediatric patient. But in case of adult, it is mid-axillary line, anterior to mid-axillary line. So this is also correct. Next question. Next option. Give 1 to 2 liters of warm isotonic crystalloid for adult in shock. Not 1 to 2 liter. 2 liter is not given. 1 liter is given. Now this is the correction. According to the latest ATLS guidelines, 1 liter crystalloid is given. 1 liter for adult in shock. 1 liter. Not 1 to 2 liter. Not 2 liter. Okay. So this is wrong. This is wrong. Next question. Next option. In children with shock, initial 20 ml per kg isotonic solution and 10 to 20 ml per kg packed cell plasma to and platelets in the ratio 1:1:1. Yes, 1:1:1 is the ratio. Remember this for the packed cell plasma and platelet. So this is also correct. So which is wrong? 1 liter. Remember this ATLS guidelines. We use video laryngoscope, wideboard needle for 5th intercostal in the mid axillary line, correct, and 1 liter is fluid is given, remember. And in case of children, 1:1:1. In case of packed cell plasma and platelet is given. Next question. Management of flail chest with respiratory failure can be found. So what is the management? So basically, what is flail chest? 2 or more places there is broken ribs, and 2 or more sides there is broken, that is flail chest. So what is the treatment? The treatment in case of respiratory failure, generally when there is no respiratory failure, for flail chest we give just oxygen and all this. But when there is respiratory failure is there, then we have to give IPPV. What is IPPV? That is intermittent positive pressure. Yes, positive pressure is given. So this one, IPPV, is the treatment. Next question. Least commonly used graft in CABG. So all these are graft. Lima, that is left internal mammary artery, that is graft. Left long saphenous vein. Saphenous vein is the graft. Radial artery is a graft. Intercostal artery is not used. Intercostal artery is least used. It may be used, but it is not used. Generally not used. Intercostal artery is least used. So remember, long saphenous, which is the most commonly used? If in case of CABG, coronary artery bypass grafting. CABG means coronary artery bypass grafting. Which is the most commonly used? The most commonly used is long saphenous vein. Most commonly used is long saphenous vein. And Lima, where is Lima used? Where is Lima used? Lima is left internal mammary artery. It is used in LAD. Remember, Lima LAD. It is used in LAD. That is left anterior descending artery. We, in case of that grafting, we use Lima. So LAD Lima, you can remember like this. So here, which is the least commonly used graft for CABG is intercostal artery. That is not used. Next question. Elderly patient fell in the bathroom, ER, present with crescent shape hemorrhage. Crescent shape hemorrhage. So that is subdural, SDH, subdural hemorrhage. And this is, what is the, what kind of blood is there? Arterial or venous? Venous blood. Remember, venous blood. In extradural hematoma, it is lens shaped. Extradural hematoma, it is lens shaped, and arterial blood. Arterial blood. Remember, extradural, there is arterial blood, lucid interval. Lucid interval. First there is consciousness, then there is no consciousness, again consciousness. That is lucid interval. Extradural hemorrhage, all this feature is there. Lens shaped and lucid interval and arterial blood in middle meningeal artery mainly. And in case of subdural, it is venous blood. That is the bridging veins. Which veins? Bridging veins. Bridging veins. Subdural hematoma. that is crescent sepate. Remember this, very important. What is dye? Dye is diffuse axonal injury. There is NCCT will be normal. Dye, the NCCT will be normal. There is no findings in the NCCT. If that is a question, then dye will be the answer. Dye, diffuse axonal injury. Okay, next question. Optional timing for administration of prophylactic antibiotic. Remember, there are two times where we can apply antibiotic. One is at the time of induction of anesthesia. When anesthesia is given, suppose anesthesia is given, at that time we can give antibiotic. At that time we can give. Another is 1 hour prior to surgery. 1 hour prior to surgery. Suppose this is the surgery, 1 hour prior to that we can give. So two ways we can give. At the time of induction of anesthesia, yes. At the time of induction of anesthesia, when anesthesia is given, we can give antibiotic, yes. That is the time. Any time during the surgery procedure, wrong. Not any time. 1 hour after induction, wrong. 1 hour before. 1 hour before of what? Before of induction of anesthesia, wrong. 1 hour before of surgery. 1 hour before of surgery. That is the right answer. Another is at the time of anesthesia. At the time of anesthesia induction, we can give. So this is the right answer. So remember, two important answer. In when antibiotic is given, at the time of anesthesia induction, we can give. Another is 1 hour prior to the surgery. Last question. Preservative for catgut suture. Catgut is obtained from submucosa of sheep. Submucosa of sheep. It is not cat. The name is catgut. It is very decisive. So you can remember there is catgut. Catgut is found from mucosa, submucosa. So not mucosa. Submucosa of sheep. Submucosa of sheep. And after some days, like 60 days, I think, it will. If it is not preserved, it will go wrong, bad. So we have to preserve. How catgut suture is preserved? With the help of isopropyl alcohol. Isopropyl alcohol is used for preservative of catgut. So this is the end of this video. If you like this video, make a thumbs up and please subscribe this channel. This channel is for helping MBBS students across the globe, and this is very much helpful for NEET PG aspirants also. Though it is I made for FMG students, but also NEET PG aspirants can get a lot of benefits from this channel. So please subscribe this channel. Thank you. Have a nice day.